Meet healthcare's secret weapons, pathologists. You may not know who they are, but you can't live without them. Pathologists are medical doctors, investigators who are relied on by every medical specialist and by patients every day.
It does look like the margins are all clear.
Every patient who has lab work done in the hospital, for instance, is one of our patients. Every day, pathologists provide a range of services. We are involved with prenatal testing. We're intimately involved in Pap screening tests for cervical cancer. We're involved in helping identification of breast cancer as early as possible and the disease process for women. We're involved in colon cancer screening and prostate cancer screening in men.
In an emergency, pathologists help ensure the safety of the nation's blood supply. For patients, they track accuracy. Pathologists seek the truth about who we are or clues to what may be causing the spread of a deadly virus. They find these in the smallest parts of our existence: a vial of blood, a glass slide containing a less than paper-thin slice of tissue, a gene that holds the secrets of your DNA. The right test at the right time can make all the difference in diagnosis, treatment, and recovery.
Yeah, there it is. So C-kit, positive or negative. Okay.
Pathologists work behind the scenes, mostly, working with a team of clinicians to make sure that patients get the right diagnosis. Having the right diagnosis is the first step in having the right care. It's critical.
As an example, if you thought somebody had a colon cancer just on the basis of looking at it, you'd need a biopsy specimen. They'd need to give you a definitive diagnosis before you could send them to surgery, before you can give them chemotherapy. It's the basis of your treatment. It's the basis for making people well.
Every tube of blood that comes into our laboratory represents a patient. 70% of medical decisions or more are based on the information that we provide the clinical team.
The pathologist's detective work is enhanced by breakthrough technologies. Digital imagery, advanced screening tools, molecular-based diagnoses that were once just imagined are today's reality. Demand is on the rise for the personalized precision health information that these technologies provide.
One of the things that has evolved over the last 10 years is molecular testing. We're able to now look for multiple drug-resistant organisms in patients prior to going to elective surgery and identify patients at high risk for a surgical site infection before they go into the operating room. We have taken technology that used to fill a room and it's been compressed into the size of a toaster. It sits on our counter in our laboratory, and we're able to run these specimens within hours and give the team the results that they need to know so we can proactively treat that patient and avoid infection.
As a society, our need for health intelligence, not just data, but intelligence, has never been greater.
One of the things the pathologists do for us is they provide data and data analysis for us that tells us about the population of patients that we're caring for. And we're able to see that the population of patients that we serve are at high risk for cardiac disease, for vascular disease, for diabetes. Understanding that population, which our pathologists can help us interpret and see trends, allows us to be proactive and plan what our community needs are and for us as a healthcare system to address them.
The pathologist's pursuit of precision extends across a continuum of care of a patient's lifetime. They're on call to examine samples taken during surgery and to review those results, which can be life-changing.
Sometimes we're the doctor's doctor. Our job is to provide consistent counsel as the patient's health changes.
In a hospital setting, they may help a provider in the ICU, for instance, make appropriate decisions regarding helping a patient who's having bleeding issues.
The patient's been on chemotherapy for lymphoma, so we want to go ahead and make sure there are irradiated platelets.
What types of blood products should be brought to bear to help stop the bleeding? By helping our providers pick the right test at the right time, unnecessary testing is avoided, and unnecessary procedures are avoided.
Pathologists may be the best-kept secret in medicine.
I'm very proud of being a pathologist. It allows me to serve a large population of patients on a daily basis and be intimately involved in the care of many, many patients, even though we do it behind the scenes.
These disease detectives are in aggressive pursuit of an ever more precise understanding of us as healthcare consumers. And as a society, the diagnostic truths pathologists reveal can help us all lead better, healthier lives. To learn more, Contact the College of American Pathologists today or visit cap.org.